that we're.
Here we are. Welcome back.
This is our back conversation.
Great.
So we're gonna have a couple people, interested parties, testifying in this, and we're gonna start with Todd Close from, AG's office. OAG. I always want to do AGO.
That is what we do. So good afternoon. Thank you, Chair. Todd Delos from the Attorney General's office. Good to be here with you all. We don't have a lot to weigh in on in the current version of H583. In fact, we're comfortable with where the bill is at this point from our perspective, with one minor suggestion or request in the very small space in which the AGO is currently contemplated operating, which is on page 12. And this is about the filing requirements, just grabbing the Title 18, Section 9773. And enforcement of those filing requirements. So there are just two little suggestions we'd like to make here. One, in the fees world, when we generally work on civil penalties, I should say penalties, not fees, we like to have some discretion downward from the available fees as a means of negotiating and operating based on the equities of the circumstance we find ourselves in. So we're requesting just adding the words "not more than" in front of $50 on line 11 and "not more than" in front of $25,000 on line 15.
Right?
And that's fairly consistent with certain other statutes, though not all of them. The only other one, and this is I think from our perspective and an enforcement perspective, an important shift on line 14, page 12 still. That lays out the standard for finding a violation of a misrepresentation in a filing. From our perspective, we prefer and would request a change to a material misrepresentation there. The difference is, and I know this isn't a committee that deals a lot with intent, but a knowing intent means I knew it was wrong and I still did it. And that's a pretty high bar in what I would consider a regulatory filing. A material misrepresentation requires us to demonstrate that it's material, but it doesn't require any intent. And I would say that in this circumstance where we're looking for transparency and where these are pretty heavily regulated entities, this is not a high burden request. I will also say that with prosecutorial discretion, we generally don't go after good faith mistakes in this circumstance. And I think with a new statute like this, there'll be some learning and growing. But we do want the ability, remembering that what the statute contemplates is these filings will go in and the care board will post them and they'll be transparent and public. And if there are material misrepresentations, the harm occurs once that information is out there, if it's wrong and material. And so that's why we would request a material standard there, not a knowing standard.
So line 14 and 16, the knowingly becomes material.
Yes, thank you, Representative Luthers. It's a material misrepresentation, made a material misrepresentation, instance of material misrepresentation.
Just thinking this is healthcare, and how many times have we had a material misrepresentation? It's a word. I see what you're saying, though, that, knowingly, it sort of implies that you can read somebody's mind, doesn't it?
Yeah.
And you have to prove. Yeah. All right. Oh, go ahead, Leslie.
I'm not sure you're the right person to ask, but you are. It's been said, so I'm thinking about nursing homes, and it's been said, we don't deal with Dale, so I don't know what goes on in the Dale land. But it's been said that the federal regulations that nursing homes are under are covered by Dale, are covered by federal law. Therefore, we don't need to have state law. And that's where the exemption comes from for nursing homes. And I just is there a way that you can help me understand that, if that's a thing?
I'm not the right person to ask.
Okay.
In this current role, I'm not the right person to ask.
Okay. And maybe you can help me find out who might.
I'm happy.
I think maybe one of our next witnesses.
Thank you very much.
Be prepared to speak on that. Any other questions? Great, thank you.
Thank you all very much.
Great. We're going to speak to Jessica Barnard now.
Good afternoon. Thank you for having me up. Jessa Barnard with the Vermont Medical Society, though more or less trying to wear the hat of a number of healthcare organizations that were involved in this process. And we want to thank you and the committee for your patience in letting us have some time to have those conversations. It was very helpful and productive, and we feel much more comfortable with where the draft is, that it really focuses on the behaviors we want to address, especially the behaviors by the private equity companies that could be involved with healthcare, rather than sort of requiring wholesale restructuring of existing healthcare entities in the state that could have been very destabilizing. So we really appreciate the more narrow focused approach that this bill takes on really the harmful types of behaviors that we don't want to see taking place in the state. We appreciate the approach that this takes to allowing healthcare providers who are within those organizations that think they've been harmed by the behavior of a private equity company to take action to enforce their sort of protections under the law, and really, again, protecting the clinical decision-making of healthcare providers in the state. I heard the question around the sort of straw ownership, straw model, and we do think that language in here addresses that. If you look at page 8, lines basically sort of 11 through 14, where it says, so this is the section that clarifies sort of the distinction between what is controlling clinical decision-making versus being able to receive administrative support from a managed service organization or other assistance from an entity that may or may not be private equity involved, but it says nothing. So it's saying it doesn't preclude sort of administrative support. However, if that support is provided, a licensed healthcare provider must retain the ultimate responsibility for or approval of those decisions. And those services cannot constitute an exercise of de facto control over the administrative, business, or clinical operations of a healthcare facility. And again, there is an ability for a provider who feels like that this is not being followed to bring an action in civil court to superior court to enforce this or to seek a remedy. So it's a little bit of a different approach. It's not through directly limiting, again, sort of ownership models or types of what types of entities can exist in the state, but it is saying that behavior cannot be controlling the actions of that healthcare facility or the decision-making of the providers. So
It just dawned on me that I forgot. So, and one of the other things that we had heard concerns over was like non-disclosure as well as
non-compete.
non-compete.
Yes.
Can you address what?
Yes.
Because it's not in.
You're right. That is something not in here is the issue around non-competes when you leave a healthcare organization. VMS has been very closely involved with and watching the progress of H205 in the Economic Development Committee. That has some really good language that we strongly support around not allowing non-competes in healthcare, allowing a healthcare provider who leaves an organization to inform patients that they have left that entity. So our suggestion at this stage, because it's also fairly complicated drafting in that bill has a lot of definitions around non-competes, non-disclosures, non-competes, non-solicitation that is broader than healthcare. And in fact, it's a broad statute in terms of many areas of employment in the state that the collective we allow that bill to move forward and let that take care of the non-compete issue. If for some reason it doesn't get out of the House or gets substantially changed and it doesn't seem protective enough of healthcare providers, that in the Senate, at least VMS would be a strong proponent of adding it in there if it's not moving in a separate bill, but that it was a little complicated to pull all of that drafting into this bill.
Basically, we're watching it very carefully.
Yeah.
We care about it, yeah.
Yeah.
Can I ask about the straw MD, so back on page 8, I think some of the testimony that we heard, but that the straw MD was from another state. And I'm not seeing that this language addresses that, and believe me, I'm not a lawyer. So does that protect Vermont entities from straw ownership from other states?
Yeah, I'm just trying to think through the scenarios. I think it would, assuming that then that healthcare facility also has any healthcare providers in Vermont offering those services. So it's saying regardless of sort of who's the medical director, the services in Vermont cannot be, the clinical services cannot be controlled by a non-licensed provider.
But not that they
non-licensed-
have to be in Vermont, because that would be that was, I think, the distinction that I was taking from that, but maybe I want to make sure I understand. Was I close?
Yeah, well, keep going.
Yeah.
If you,
Heather, could you just clarify who has to be in Vermont?
The owner of the entity. Like it couldn't have a straw MD, let's say, from outside of Vermont.
Okay, I still do think, again, it's addressing it through a different approach. It's not addressing it sort of through that language around who can own a practice, but it is instead saying that the decisions and the clinical actions of that practice cannot be controlled by an entity providing that's providing that non-clinical support. So I think it does address the behavior of telling that practice and the licensed providers in that practice how they can do things or not do things. That whole list that's up
Yeah,
on pages.
really-
Yes, all those lists. In our view, this is a strong approach to addressing that issue. It's just a different way of approaching it.
Yeah.
A different.
But does it reach the same endpoint? I guess that's the question. What's the endpoint? And the endpoint, my understanding was not having out people from away controlling Vermont healthcare facilities. But does that do that? Or maybe-
Well, I think it addresses the behavior. It's not saying you couldn't have a medical director from out of state. And actually, that's really intentional because we actually need a lot of types of facilities in Vermont do need to work with medical directors that may not always be based in Vermont. If they're working here in Vermont, they also do have to be licensed in Vermont. Any healthcare professional providing clinical services in the state have to be licensed in Vermont as well. It does not preclude working with an outside medical director who's not always based in Vermont, in partly intentionally, because we want to make sure we can have, you'll hear, I think, after me about long-term care, but entities that may need to work with sort of medical director staffing models. So we don't, the healthcare providers are actually concerned about preventing those medical directors. However, we agree with parameters around the type of behaviors that could be undertaken in Vermont.
thank you.
Yeah.
Any other questions from, just for the record, I asked if everybody wanted to testify and they were like, no. Jessa is one of the representatives. Thank you.
Thank you.
And next one, because you can't just have one. Laura, you want to come on up?
Sure, I mean, I'd prefer not to have to say.
Laura ran to the other side of the room.
Take me out to dry here.
No.
Laura Pelosi, I'm a lobbyist at MMR and I represent the Vermont Healthcare Association. I'm here for Helen Laban today. And I had her job for many, many years. I have a long history working with the long-term care facilities in the state of Vermont. And I really just want to respond to Representative Goldman's, concerns. And we're happy to provide some very detailed information to the committee. But the concern around why nursing homes are exempt from the reporting requirement, the requirement to report on ownership to the Green Mountain Care Board. And that is because CMS, the federal government, has very detailed ownership disclosure requirements that nursing homes have to file, including around private equity, real estate investment trusts, affiliates, who's involved in all of their operations. So we can provide that to you. It is all publicly available on the CMS website. So the concern here is making sure that there's not a duplicate reporting requirement for entities that are honestly, struggling. So making sure that they don't have a duplicate reporting requirement. It is all already publicly available. And I do just want to bolster what Jessa mentioned with respect to the outside medical groups and the medical directors. That has become an absolute necessity for long-term care facilities to be, nursing homes in particular, to be able to work with medical groups. We have a real challenge getting physicians, Vermont physicians, to come in to serve patients in nursing homes. It's been a particular problem since COVID. Everybody's under stress. We've got significant access issues. And so we need to make sure that those facilities have the ability to bring those medical services to their residents. So
And you and I have been talking about it. I really appreciate, you're trying to help me bring me along.
bring you along.
And as I say, I don't know anything about
Yeah.
it. And, but I would imagine that when Genesis owned, I'm going to go back to my personal experience in
Yep.
my community, Springfield Health and Rehab, I think it was called at the
Yes.
time.
Yep.
That those federal regulations were in place,
Yep.
that Dale was theoretically following along, and yet, that entity was stripped. Residents were treated terribly. And so I don't have, and this is
Yeah.
where I'm coming from, and you know this,
Right.
a lack of confidence in the system as it is. And so what I struggle with is that you're asking me to believe in a system that didn't work and giving up any kind of access to a system that might work.
So I want to kind of separate out the issues a little bit, right? So there's the reporting on the ownership, and then there's the regulation, the actual regulation of the quality of care within a facility. And I think, if you're talking to the Agency of Human Services about their role, so the Division of Licensing and Protection will survey unannounced surveys, nursing homes under both state nursing home regulations and federal nursing home regulations. And then CMS can bring in federal surveyors to go in and do unannounced surveys and inspections, right? So there's a regulatory process around quality of care, and that is the process that addresses those issues, should address those issues, right? And then we have the reporting requirement. So I want to be clear, the exemption here is just from the reporting requirement to the board because they are already doing it at the federal level. Nursing homes under this draft bill are still subject to the corporate practice of medicine, right? So making sure that private equity can't control clinical decision-making in a nursing home. So that applies to nursing homes under this bill. It's merely the duplicate reporting that we're trying to make sure we can avoid. So, if you're curious about the 900+ page surveyor manual and all that the surveyors do when they go in to inspect a nursing home, you're probably better off hearing about that from the Agency of Human Services and the Division of Licensing and Protection. But that's a real quality of care regulatory issue.
And as I say, I'm not having confidence in the quality of care management right now because of the experience in my community. So that's just
Right.
reiterating
And
where I'm coming from.
Genesis has moved largely.
They're gone,
moved
and know
on.
it's a layer, and they're not private equity, and I get
Right.
all that.
Right.
But there were people harmed. Way too many.
Topper?
One question.
Yeah.
Thanks for coming in.
You're welcome.
How often do nursing homes get inspected?
So they have an unannounced inspection. I think it's still a minimum of every 15 months. And then they will go in on complaint investigations as well. So if they receive a complaint from a resident or a family, then surveyors can go in and do unannounced complaint investigations on top of their regular unannounced licensing surveys.
I want to make sure I understand what you said. Every 15 months.
You have to have.
every nursing home in the state of Vermont gets inspected.
Correct. I believe it's still 15 months. It's been a while since I've been this involved, but I believe it is still every 15 months. They have what's called a survey cycle.
Right.
Surveyors go in and survey under the federal and state regulations. And then they can do unannounced, surprised investigations and inspections if they receive a complaint about the facility.
Go ahead, Kim. When I think of the burdens of federal reporting requirements you have, that seems quite onerous. But I'm looking at the information mentioned in this video, and it's really just, it doesn't seem too heavily onerous, and maybe there are certain sections you could point out that you feel are, but it's just saying, are you, is there this, if it's not a private equity ownership interest, you say, well, that's not us. And if it is, you say, well, here's the address, here's the owner, the
Right.
interest, the controlling interest. It's
Right.
a pretty light reporting requirement, but maybe I'm wrong and you can.
Right. I think it's an administrative burden piece. We don't want to also have two different standards or processes for doing it, right? So I don't see any reason why the board couldn't link to the CMS webpage that people could go on easily and see it all there, but it is very detailed. I think it's the issue of adding on another requirement or facilities who often are, it's one person doing all of these things or two people in a facility doing all of these things. So, but they are already reporting in a very extensive way.
It sounds like they are. And
Yeah.
so if you, this seems like a very minimal polling of what you're already doing. Like, we are owned by private equity and so forth. But if you just link us to this huge, massive thing that some administrative burden is happening somewhere, someone has to make a point of trying to look at it and then trying to understand it, and it's many pages, and this is very relatively simple. I'm just curious about the particular burden in these items.
I think the more, there are a lot of regulations that these facilities are under, right?
Sure.
And so continually adding things that they have to do and have to keep track of when there's already a reporting structure and mechanism and it's already very detailed. Nobody wants to make mistakes, right? So, and I think, again, it's just the same group of people running these and operating these facilities on a day-to-day basis. They have a lot to do, and asking them to do yet another thing to comply with a regulation that they're already complying with information that's publicly available. It's truly an administrative burden issue. And I will say that, CMS they've redone their guidance multiple times because in terms of how to report, because it's been highly complicated, right? So they finally have this kind of like well greased, I think, or better greased in terms of how to make this, operationalize this a little bit more efficiently. So I think we're just trying to avoid a duplicate standard here and keep some of the pressure off. Again, it is all publicly available. You can go to the Nursing Home Compare webpage. You can look up every single nursing home. You can look at all of their inspection results. You can look at all of their ownership information. All of that is readily available.
Is there anything on the websites of the nursing homes that says there's a significant equity investor, like just clearly states that?
I can't answer that. I do not know that.
All right, yeah, thank you.
Thank you, Laura.
You're welcome.
Appreciate it. Devin, want to come on?
That's not fair.
Just kidding. I guess last we'll have, healthcare advocate. You guys want to come together?
We'll come together.
Oh,
Buddies.
It's like a comfy chair.
Yeah. Good afternoon, House Healthcare. I will talk process and Sam will do content to the extent that there's any questions or need to do content. This has been I am Mike Fisher.
Who are you, sir?
Yeah, I am Mike Fisher and you are Papa.
And Sam Peisch, the healthcare.
This has been a long and challenging process. And I want to acknowledge that. And because it's the right and gracious thing to do, I want to thank the provider community. They come to this with from a very different perspective than we come to it. There's no secret that we were after significantly more protective stance than I think was in front of you. But we did come to agreement on a step forward. And while I'm sure there may be people who in this room and beyond who feel frustrated by things that are not in the bill, we are here to support this draft as a meaningful step forward this year. And so maybe that's enough to say for me about process. I've been around this process, this business long enough. I know that we fight some days and we work together on other days. This has been a harder one in my experience. But here we are, and I'm thankful that we have something to bring over the line that advances the protections that we think need to be in place.
Yeah, no, thank you, Sam Peisch. Thank you, Mike. So I wanted you to start off because you've been through this before. Yeah, just in terms of content, I really just want to say that if you pass this bill, which I strongly encourage you to do, it would take a really meaningful step forward. And again, I would also echo what Mike said. Thank you to the providers for working with us. just thinking, I want to encourage folks to think about where we are and what existing laws we have on the books around corporate practice of medicine, which is extremely limited to non-existent. If you pass this bill, we would have a corporate practice of medicine doctrine and statute. That's a big deal. The reporting elements, so there's been a lot of questions about reporting. Do we have the right information? We would have that much better reporting if this bill was passed. I think we've heard a lot of testimony about the need for enforcement. There's not really meaningful enforcement at the moment in Vermont. There will be if you pass this bill. So all those pieces, you know, again, like we can't arrive at this at the beginning in a different place, but this would still be a really important step for Vermont for protecting providers and patients. And we encourage you to support it and happy to take any questions.
Okay, Alan.
Is there any documentation on how many entities have been purchased by private investors? 2 years, 3 years, 4 years?
I think this bill seeks to help answer that very question.
But I just wondered, has it been an issue?
We don't know.
We don't know.
We're trying to fix something that we don't know.
That's fine.
In this case, we're trying to create some transparency, so we do this.
That's the reporting pieces. We're trying to find out the answer to that question. Go ahead, Leslie.
This isn't really a question for you guys, it's more of a statement. So I just went to the website that was recommended. Springfield Health and Rehab is reported on the Medicare website as having been cited for abuse. This scares me. It's not okay. So I'm still concerned about excluding nursing homes. I'm just, because there are people here. And anyway, it really bothers me.
I didn't know if you wanted to.
I think the one thing
I'll go because I share that concern. I also think it's an enforcement issue and it's one that's done at Dale. It's not private equity. Anyone, and we've seen abuse happen outside of private equity settings. Anyone can do it, and we need to hold Dale accountable for doing their job of enforcement. I just wanted to add that.
Well, do we need a section in here that does that?
No, I think it's outside the bill. It's not to do with private equity. I think it's an.
You're right, you're right.
It's
I'm
an-
just so upset to just even go to
It
what
is.
you recommended and see what this says.
I agree, Leslie.
the one other thing I would add is that we recognize quickly that nursing home concerns were really live in a committee down the hall. It's next door, 2 doors down. That any sort of attempt to address the issues you're raising belong in that committee. And then the one other thing I would add is, to the extent any individual is interested in getting some insights as to what's going on in nursing homes around the state, I really recommend that you talk to the long-term care ombudsman. She runs a staff that's there taking complaints at every nursing home and would have a perspective that might be worth hearing.
If I may reply, I think a complaint-driven process is fraught because people have to complain.
Yeah.
And in my experience, people don't complain, they just move their loved one or they die.
Yeah.
So, okay, I get it.
Yeah.
Anything else?
I'll also say thank you to the committee. You guys became experts. You listened to,
Let's not.
you guys listened to experts. There was quite a good parade of really well-informed testimony that came to this committee, and that was an important area.
And thank you for bringing in some of these experts, because, I mean, obviously it's a subject matter that we have never really dealt with before. And frankly, it was alarming. Okay, so we have a couple tweaks, I believe, that we need to make. I want to make sure we're going to change a couple words here and there that, yeah. Oh, I'm not voting on this today. Does anyone feel as though they need any additional testimony on this bill before we vote on it tomorrow? Yeah, go
You
ahead.
haven't heard from a hedge fund billionaire yet. Just kidding, just kidding.
Somehow I don't think that they actually like listen to our committee during the day, but if one's out there.
Gonna find a horse head in my bed later.
Um, I want to thank everyone, for this, honestly, and, you know, the healthcare advocate spoke to this. This was my and Representative Bloomley's bill. And I care very, very deeply about this bill. Did I become frustrated through the process? Yes. Is it everything that I wanted it to be? No, but it's a start. I think I met with the AG's office this winter and I said, I at least want to get something on the books. I wanted to get more on the books, but it's a good start. It's a start. So I thank everybody for coming together and coming up what you did. And I apologize for any of my frustrations. And I couldn't let Topper get a bill through and not me get a bill through. So that's
Truth comes
it's
out.
like we've been doing 585 and 583 the whole time.
There's a big difference. This is just a question for you, Madam Chair. Or the committee. Do you think we need to listen to any more testimony as an example of what was recommended for long-term care off? Or do you think you have enough?
I think the fact that we have exempted means that that we've heard enough on that. And if in the future, the committee down the hall would like to, they will do it. And also, don't forget, this is a House bill, which means it's going to the Senate. So, you know, who knows what the Senate's going to do.
I just wanted to comment that how the persistence and the dedication, trying to work on this subject is very commendable. Thank you.
And thank you, everybody. Thank you, everybody who worked on it together. Okay, so we are going to take a break until 3 because we don't actually have Katie until 3.